Big cities are getting hit the hardest by the coronavirus right now. Nearly half of Indiana's confirmed cases are in Marion County. There are only a handful of Indiana counties that aren't reporting any positive cases of the virus, and all of them are in rural areas. About a third of Indiana counties are rural. People are more spread out and naturally practice a little more social distancing, but the virus is still spreading to these communities. And as Brock Turner reports, the challenges facing medical systems across the country is even more acutely felt in these rural areas.
Cities and towns are eerily quiet as residents seek to comply with Governor Eric Holcomb's stay-at-home order. While it might be easier for residents to be less congregated in these areas, health systems here just aren't meant to handle a pandemic. Indianapolis has a population of nearly 900,000 people, but cares for them with several hospitals and a handful of trauma centers. Estimates show the city has access to over 500 trauma beds, and that number could increase. Compare that to Adams County, which was one of the first rural communities in the state that reported a case of COVID-19, and the differences are glaring. The county's population is about 35,000, and they only have a single hospital. 16 counties in Indiana don't have a single bed or hospital. The majority of Indiana's rural communities are served by critical access hospitals. They have to abide by all sorts of federal regulations, including limitations on their size. And while some of those regulations have been loosened recently, usually the maximum number of inpatient beds they can have is 25, and most are only equipped with a few ICU beds.
I think the challenges are that our resources don't run very deep.
The Greene County General Hospital's CEO Brenda Reitz says there are a number of things her hospital is trying to overcome. Those include issues with capacity, medical supplies, and staffing.
With larger facilities, you have more depth to your staffing pool. You have more depth to your supply chain. And in communities like this, you're maybe one or two layers deep at all. But I also acknowledge that is somewhat proportionate.
An executive order from Governor Eric Holcomb now allows retired healthcare workers, along with graduating med students and out-of-state practitioners, to help care for the potential surge in COVID-19 patients.
We're working to increase the workforce and remove barriers to retired healthcare providers returning to work in some capacity. Personnel and equipment are obviously needed to address this crisis.
Reed's staff has gone to extraordinary lengths to find equipment.
Yep, we're right there. We've been to the local hardware stores and we've checked out their inventory, and yes, we have.
She also worries about the number of ventilators.
The first several orders that we placed were declined because of back orders. So while we have a few right now on order, we haven't received them. So, and we don't count that we have anything till it comes in the door.
Hospitals have begun operating and reporting in their public health preparedness districts. That allows facilities to pool resources in hopes of bettering patient outcomes and helping manage a potential influx of patients. But to make matters worse, the finances of many hospitals are also taking a hit. Facilities usually rely on elective and outpatient procedures paid for by private insurance companies to boost their revenues. The emergency services they provide typically don't add revenue and cost a lot to maintain. That's causing concern as many hospitals cancel elective procedures to prepare for an influx of COVID-19 patients.
Many of our rural hospitals, the largest share of their payment, the revenue they receive, comes from government sources, Medicare and Medicaid, that pays well below the cost of delivering those services.
Tabor says he worries that some hospitals could even close.
But the economics of that are not going to play out for very long in a way that will allow many small hospitals or anyone with fragile finances to survive.
Executives agree it's difficult financially, but for now, more are focused on the short run. For Reitz, it's not her facility's finances that are keeping her up at night. Rather, it's her employees, many of which are friends and neighbors.
First and foremost, it is our staff safety. I worry. They put their lives on the line every day when they come to work, and that seems a little dramatic on most days, but in a scenario like this, it really is true, and I appreciate what they do, and I just want to keep them safe.
For Indiana Newsdesk, I'm Brock Turner.